American Indian and Alaska Natives experience disproportionately high rates of a number of maladies: suicide, diabetes, and tooth decay. One proposal from the Coeur d'Alene tribe seeks to address these disparities in dental care in a culturally sensitive way, but some dental professionals are worried about patient safety and whether the proposal sets a different standard of care for tribal members.
You can hear, the drills going in the back and young kids screaming. I can remember I was just a young boy going up to the dental facility and having to wait in line. There's usually a long line waiting outside for one dentist.
It was always somebody different that we saw.
We had IHS provide a mobile dental clinic in, I believe, once every quarter. They would come up and provide dental care for the Coeur d'Alene tribe.
I think they would come from out of town and have a certain amount of time to see us, and they just wanted to get us, in and out.
Didn't really care about if we were in pain while we were receiving our dental care. A lot of times the numbing shots didn't take effect, and you can really feel them, drilling.
In this particular community, we have a lot of people who do not like to go to the dentist. They have a lot of fear, and some of that is intergenerational fear. And because of that, Natives experience one of the highest tooth decay rates that there is.
Statistically, Native American kids have 4 times the dental decay rate of Caucasians and twice that of any other demographic.
Definitely there's a lot of decay. A lot of people lose all of their teeth. My mother-in-law has full dentures, my father-in-law has full dentures, and they don't even know how to take care of their teeth.
Idaho's tribal communities, like American Indian communities across the nation, are struggling with high rates of untreated dental disease. But the Coeur d'Alene tribe has a proposal to address some of those needs in the form of a new type of provider allowed by Idaho law.
A dental health aide therapist, or a dental therapist, is a mid-level provider that performs a limited scope of practice that a dentist would perform. Routine, preventative treatments, including simple extractions and fillings.
The Dental Health Aide Therapist, or DHAT program, was first introduced in other countries and then in Alaska.
This is a program that's been in 23 other countries for years. There's 8 other states that are working on this program.
But the Idaho Dental Association has concerns.
The bill that's been presented has a number of issues for us. So it's a very wide open bill that we believe fundamentally puts the patient at risk. The dynamics in Alaska are very different than the dynamics in Idaho. This program was put in place to really deal with a truly frontier population, where you're going hundreds of miles before you see a dentist. You have dentists that don't live in the communities, they have to be flown in. We don't suffer from a lack of access to dentists. That really isn't our problem. We have 90% of the population that lives within a 15-minute drive time of a dentist.
The problem? Many of those dentists don't accept Medicaid or are otherwise unaffordable to some patients. The idea the Coeur d'Alene tribe is promoting wouldn't necessarily open more offices, but would allow DHATs to operate under the supervision of dentists who already serve tribal and rural communities. Nez Perce Tribal Executive Committee member Chantel Eastman says a DHAT would help the understaffed Nimipu Health Clinic in Lapwai.
We had 2 practicing dentists. We have now gone down to 1. We no longer have a dental director. We have 1 dentist to travel an hour between each clinic site that we have.
The Nez Perce tribe has had trouble filling those open positions.
Our patient visits were about 2 to 3 months out. from being able to be seen. Our emergency situations are about 5+ a day. And that was previously, the numbers are going to jump because now we're starting to see that gap that haven't been able to achieve had we had a DHAT in our program.
The answer is not bring in another provider type. The barrier to accepting Medicaid is a cost issue.
The Dental Association also has concerns about the training DHATs receive. In short, a DHAT receives fewer hours of training than a dental hygienist, but has more authority. And supervising dentists don't necessarily have to be on site or even in the same town as the DHAT.
You know, it's one thing to be under the direct supervision of your instructors and know what you're being trained on. It's another thing to put it into practice.
In a phone interview with Idaho Reports, Oregon dentist Dr. Bill Tempest outlined issues he saw with his state's program, like poor record keeping and oversight issues.
When you do surgery, oftentimes, and it's not malpractice, but oftentimes a root will break or something like that, and it's important to follow that and see if anything remains in the surgical site after the work has been done. Some of those post-op or pre-op x-rays were not taken.
So for a community with a history of substandard care, does this proposal perpetuate that cycle of poor medical care for people of color?
Why not let us help ourselves? Let us make that choice. You know, we know what we need as a people. We know what we need as moms, as dads, as aunties, as uncles, as grandparents. And if we want to train our people for subpar care, how is that your business?
And the Coeur d'Alene and Nez Perce tribes maintain the care isn't substandard at all. In 4 years of dental school, dentists are trained on 500 procedures. DHATs, on the other hand, are trained on 46 procedures in 2 calendar years, plus 500 hours of direct supervision after they graduate. In other words, it's less time, but it's more focused. Then there is the issue of who this program would apply to. Though the proposed legislation comes from the Coeur d'Alene tribe and is meant to help with tribal dental care, DHATs aren't limited to tribal members or communities.
And first and foremost, we do absolutely respect the sovereign rights of the Native American tribes. And if their proposal were truly sovereign and looking at Native American populations on Native American clinics and Native American lands, we would respectfully stand down and stay neutral on their position.
To limit healthcare to one class of patients, for one, it just doesn't even sound right. But in addition to that, Mariman Health was founded upon a model to deliver care to the entire community.
Even if there were more dentists, and even if those dentists were affordable, there is still a barrier that those outside of tribal communities may not quite get. That comes down to trust, a connection over shared cultural experiences, and understanding that trauma and fear over poor dental care they or their parents may have received from outside providers in the past.
To have an outside provider come into our community, it's basically sitting somebody down who will never be able to understand unless they've experienced what your community goes through.
I think our Native people have been through so much that, to have somebody that understands that and are more sensitive to it makes us more comfortable. Then we're more likely to seek dental care, medical care, if we feel comfortable with that person.
We absolutely do recognize and believe that cultural sensitivity is important, and we are committed to that. That said, all Idahoans really deserve access to appropriate levels of health care.
And the Idaho Dental Association points to an existing kind of provider that could help bridge that gap.
There is a role called the Community Dental Health Coordinator, and it is a relatively new member of the dental team. There's somebody who's experienced in oral health, so they have a dental hygienist background or a dental assisting background, and then they go to school and they get incremental training that's really around case management. One of the most important factors of a community dental health coordinator is that they come out of the local community that they go back and serve.
But someone with a dental hygiene or dental assisting background can't do the same procedures that a DHAT can. Dr. Matt Johnson of Merriman Health Clinic in Plummer says a DHAT would help free up his schedule to work on more advanced issues.
They're not going to do the kind of extractions that, are close to arteries and nerves, the things that you start talking risky procedures. This is people that have gum disease and wiggly teeth and things that are ready to come out already. But again, it's something that it's really simple for us, and it takes time out of our schedule that we could be using to actually work on patients with more complex issues.
So why not send tribal members to school to become hygienists or dentists? That comes down to cost.
Not everyone can afford or want to go to dental school. I've talked to people who said that they're coming out of dental school with $500,000 in debt, and that's if they can get in. It's just not a realistic goal for everyone. And some people may not want to go through that, but if they could do something less and perform a limited number of procedures while attaining a better career for themselves than a dental assistant.
And you're going to find a pattern, I guess, of the Coeur d'Alene tribe being really aggressive, really trying to find out what we need here for our community, for our tribal members, and certainly willing to make changes to adapt and not just stay with the status quo of we'll receive what we get.
And we have a quick update on that story. On Thursday, the Idaho State Board of Dentistry held a special meeting to consider a new draft of that DHAT bill. The draft legislation gives the Dentistry Board oversight and authority over the proposed DHAT program in an attempt to avoid the problems that came up in Oregon. Still, board members brought up concerns such as patient safety and the fact that the training program isn't certified by the Commission on Dental Accreditation. Ultimately, the board decided to remain neutral on the tribe's proposal. Tyrell Stevenson of the Coeur d'Alene tribe says he's confident the Alaska training program will be accredited soon, and he will continue to pursue the legislation this session.